Hello everyone, my group and I are presenting about chlamydia, gonorrhea, and syphilis. Chlamydia, gonorrhea, and syphilis are three examples of sexually transmitted diseases, or STDs. STDs are infections acquired during sexual contact either through oral, vaginal, or anal. These infections can be caused by bacteria, viruses, or parasites. Chlamydia is an infection caused by the bacteria Chlamydia trachomatis, which is shown below. This infected about 1.8 million Americans in 2019. Chlamydia often presents with no symptoms. However, for women and men who are symptomatic, they may present with abnormal discharges and burning sensation when urinating. For men, they may also experience pain and swelling in one or two testicles. If the rectum is infected, rectal pain, discharge, and bleeding can occur. Chlamydia can be treated with antibiotics. However, if it is left untreated, complications can occur. For example, the infection can spread to the fallopian tubes and/or uterus. This can cause pelvic inflammatory disease, or PID, which may result in infertility or ectopic pregnancies, which is when the fertilized egg grows outside the uterus. An infected mother can transmit chlamydia infection to her child through birth, which can cause serious health problems for the newborn. Gonorrhea is an infection caused by the bacteria Neisseria gonorrhea, which is shown below. This infected about 616,392 Americans in 2019.
What are the symptoms of gonorrhea? Men with infection can present with burning sensation when urinating, white, yellow, or green discharge from the penis, or painful or swollen testicles. If infected in the rectum, patients can present with discharge, anal itching, soreness, bleeding, painful bowel movements. Women with infection can present with painful or burning sensation when urinating, increased vaginal discharge, or vaginal bleeding between periods. Gonorrhea complications. If a person is infected and it is left untreated, then it can lead to PID, tubal infertility, ectopic pregnancy, and chronic pelvic pain. Additionally, the resulting inflamed cervix from an infection can leave a woman more vulnerable to HIV transmission from an infected partner.
Syphilis is caused by Treponema pallidum, a spirochete bacteria. The cases have been on the rise since 2000, and in 2019, there were 129,813 Americans infected with syphilis. There are three stages of syphilis. The first stage is primary syphilis, which occurs within 2 to 3 weeks after first contact with an infected person. A characteristic of this stage is painless lesion called chancre on the site of infection that can resolve with or without treatment. However, the person can move to secondary syphilis when left untreated. In this stage, the bacteria spread through the bloodstream and cause infection throughout the body. Signs and symptoms during this stage might be unspecific, such as swollen lymph nodes and fever. However, a hallmark of this stage could be rashes that appear on the palms or soles of the feet, which rarely occur in other diseases. Lesions can also appear on the mucous membrane, giving a unique appearance like snail track as shown in the picture. During the latent period, an infected person can experience no symptoms. However, relapse is possible and the person could be infectious. After several years without treatment, syphilis can progress into tertiary syphilis. At this stage, the damages caused by the disease are irreversible. The most common manifestations include coma, neurosyphilis, and cardiovascular involvement. Coma looks like tumor that can grow in the liver, bones, or skin. Neurosyphilis affects the brain and spinal cord, which can cause loss of sensation, paralysis, and mental disorder. Cardiovascular involvement could cause an aneurysm of the aorta and arteries, which leads to sudden death. Complications of syphilis are brain damage, blindness, deafness, facial deformities, and multiple organ failures. Also, transmission during pregnancy can result in stillbirth, infant death, or congenital syphilis. Congenital syphilis is characterized by Hutchinson's triad, which include abnormal teeth, inflammations of the cornea, and deafness.
How are different STDs diagnosed? So as you can see from the graphic, Syphilis is diagnosed through a blood test, and gonorrhea and chlamydia are done through swabbing and a urine test. Here we have screening algorithms that healthcare providers use when deciding whether or not to test their patients for STDs.
The first set of treatments are for chlamydia and gonorrhea. According to the CDC, the first-line therapy for chlamydia is 100 milligrams of doxycycline orally twice a day for 7 days, or 1 gram of azithromycin orally in 1 dose. For gonorrhea, the first-line therapy is 250 milligrams of ceftriaxone injected into the muscle in 1 dose, or 1 gram of azithromycin orally in 1 dose. The second-line therapy is only used in the case of allergy or if the first-line therapy is unavailable. Note that sexual partners must also be tested or treated. Treatment for syphilis is based on the stage of infection. For primary, secondary, and early latent stages, a single dose of benzathine penicillin G is injected into the muscle. Then, for late or unknown stages of infection, the same drug is given in 3 doses each at 1-week intervals. Again, sexual partners must also be tested and treated.
So in this slide, we have a table that shows the number of individuals affected by chlamydia and gonorrhea in all of California. And then below that, we have a comparison to the number of individuals with chlamydia and gonorrhea in San Joaquin County alone. In the second visual, we have a bar graph that shows that in 2018, San Joaquin County had the 3rd highest rate of syphilis in California, the 2nd highest rate of syphilis in women of childbearing age, and the 3rd highest rate of congenital syphilis. So chlamydia, gonorrhea, and syphilis and other STDs are usually found in teens and young adults, mostly girls and women. It is also found in low-income communities, the homeless, in sex workers, minorities, and individuals who are in the correctional system. Objectives for communities. So it is very important that we provide education to our community. A lot of people have misunderstandings and assumptions about STDs and the way they are spread, specifically in gonorrhea, chlamydia, and syphilis. It is also important that we provide these individuals with screenings, testings, and treatments. And lastly, we also want to provide counseling to these individuals so that they know which way to go and what steps next to take. To go more in depth on what was covered in the last slide, we want to provide proper information and resources. So we want to direct people to websites such as the San Joaquin County Public Health Services or other programs like that. We also want to direct them to early disease screening so we could prevent further spread of these diseases. We want to educate the patients. We want to talk about abstinence, safe sex practices, such as only having a single sexual partner or being comfortable with asking multiple partners if they have been tested or not, and the proper use of condoms or barriers. And then while giving this education, we want to make sure that we always have non-judgmental attitudes and we keep our own biases to ourselves. We have provided some resources found in San Joaquin County. So these resources are good for preventative measures and for treatment. So a lot of these offer free screenings and early detection to individuals. They also offer STD treatment to those who need it. And they are very valuable resources for educating the people about sexually transmitted diseases such as gonorrhea, chlamydia, and syphilis. And with these resources, we can prevent the further spread of these diseases.